Hello, everyone. Once again, welcome to our first virtual winter school. I think you know me, but for further introduction, I want to introduce myself once again. It's Aylar Youssef Begi. I'm fifth year dentistry student from Tehran University of Medical Sciences, and I'm also chief of the Students International Committee. It's my pleasure to be your host during this 1 hour panel about COVID-19 and impacts on dentistry. Thank you.
Good morning, everyone. I hope you have started a great day so far. I am Melika Zangene, a fourth-year dental student here at Tehran University of Medical Sciences, also the chief of International Students Committee, and please accept my warmest regards for participating in our first virtual winter school. And this is our picture. So in today's 1 hour panel, we're going to talk about the COVID-19 and its impacts on dentistry and how everything has changed and how we have coped with this new virus that has created a crisis.
Okay, during this 1 hour panel, we're going to give you a brief introduction about COVID-19 and its impact on our lives. Then we are going to discuss some frequently asked questions and challenges in dentistry regarding COVID-19. And at the end, we're going to have our special guest that we have an interview with him, and at the end, discussion and sum-up panels.
First, I want to tell you the story of how it all happened and where it all originated from. We all know that coronaviruses are a group of viruses, some cause diseases and some not. And this newly known coronavirus is from the family of SARS. It's called SARS-CoV-2 or COVID-19, and it appeared, as you all are familiar, first in December 2019 in Wuhan, China. Although the health officials are trying to trace the origin of this new virus, but there have been concerns. Some say that it may have been generated in the seafood markets in Wuhan, China. But the result of a study that came out in January 2020 showed that the early cases of the virus who showed symptoms were not using any kind of product from that seafood market. So the debate is going on about the origin of this virus.
Okay, I think I'm pretty sure that you have a specific order of patient screening in your school or your own clinics. But we are already know about temperature measurements by digital thermometers, oxygen saturation measurements with pulse oximeters, and some kind of self-assessment forms that we are giving to our patients to simply just answer some questions about themselves. But what is the correct order of patient screening? I want to tell you that what I want to insist on now is to consider self-protection principle as a first thing that you need to know. I mean, you are responsible for your own lives first. And at the second step, you can be responsible for others' lives. After scanning the patients with those like temperature, pulse oximeter, and so on measurements, you will face different scenarios. By that, I mean, whether your patients are doing well, everything is okay, so he or she can enter the clinic or the ward, or the patient is suspected to be affected by COVID-19. In this case, you need to have further evaluation. Whether the suspicion goes stronger, so you need to refer the patient to medical centers, or simply everything is correct, and that was the error by measurement devices. And these are some true picture of our staff that are preparing some PPEs, package of PPEs that, as you may know, these packages are going to be autoclaved. And yeah, this is again the picture of our staff giving those PPE packages to our students. And again, our picture.
So there's a great concern for dentists of how they do self-screening for the referred patients. So can I just, yeah. There are some certain questions that we should ask our patients before admitting them to our own clinic or to the university's clinic. First of all, we should ask them about whether or not they have traveled during these last 2 weeks, and whether or not they are feeling the following symptoms that I'm going to talk about. The 3 most important symptoms are cough, dyspnea, and fever. But there are also some symptoms with lower priority, but they are to be considered as well, like chill, malaise, rhinorrhea, nasal congestion, sneeze, headache, and stomach ache, and nausea, and all these signs should be considered because, as we all are all aware, this new mutated type of virus has spread all over the world. So any unusual sign that we see in a patient may be connected with COVID. And as you can see here, it's one of the steps before coming into clinic. Even for the students, their temperature should be measured, and they should pass some self-screening stations before coming into the clinic, and the patients as well too.
Okay, I already talked about the importance of self-protection for you as dental professionals, but what are some important points regarding these self-protection principles? I want to tell you that if you're in a place that you do not have mask, please cover your mouth and your nose during sneezing and coughing. And if you have mask, please be sure that your mask is properly adapted to your face, so there's no gap between your mask and your face. When you're going to apply your mask, please do not touch outer surface of mask because simply you shouldn't touch the outer surface. Please use the syringe, like plastic syringe or cloth syringe, for applying the mask and for taking it out. Do not reuse disposable masks twice, or do not use wet masks. When simply it gets wet, please discard it. Do not be stingy when it comes to your health. And please wash your hands, ideally with soap and water, or if you're not reach any tap water or soap, you can use disinfecting solutions before applying your mask and after taking out your mask, because you do not know whether it's clean or not. And I want to tell you some important points about people who are more vulnerable against this infection. These are patients, elderly patients over the age of 60, ill and weak patients, pregnant women, specifically in second and third trimester of pregnancy, and also patients with chronic diseases like chronic kidney and respiratory diseases are more susceptible to coronavirus infection.
As we may all be aware, the transmission ways of this newly known coronavirus are in 3 ways to define. First of all, as we all know, human contact, then contaminated objects, and last but not least, air transmission. But I want to explain a little bit more about this. The routes of transmission for COVID-19 were mainly the three that I discussed in the last slide. But in dental clinics, we are also faced with respiratory droplets, which can be generated from coughing, sneezing, or even talking. And the inhalation of these droplets will cause the virus to transmit. We also have fecal oral transmission that the ones working in a laboratory with feces, they may be contaminated and they should look out for this. We also have indirect contact transmission. In this case, the droplet contaminates the surface and the hand touches the surface and the infection happens. And at last, we have aerosol transmission. The droplets are suspended in the air and loose water, and the pathogens come from the core. And the aerosols can fly from distance to distance. And we are now aware by the research that this novel coronavirus can remain in aerosols for 3 hours. It means that even with the physical distancing and all the other protocols, we may not be sure that this room's weather is contaminated with aerosols or not, especially that we work in a dental clinic. As I have mentioned, we are among one of the highest risk groups for this virus, basically because we work with aerosols and we have a close contact to our patient. We need it in our job, and the physical distancing doesn't work here. So what are the general ways that this virus can infect the dentist? We all know that there are aerosol generating procedures, the droplet inhalations, and the eye exposure. That's why we just put on shields or goggles. The saliva and other body fluids like blood, which we work with often, and the contaminated surfaces of the dental clinic. They can all work together to the transmission of the virus.
Okay, what are the requirements for dental clinics? What are required equipments for dental clinics? I want to tell you that what you need to equip your dental clinics is simply, I know you already know these things. First of all, some equipments for sterilization your instruments. This is really, really important. Class B autoclaves are ideal equipments for that. Using alcohol-based disinfecting solutions and gels. Please make them available in waiting rooms and also in different parts of the wards as much as possible, because they are really, really important for people who cannot reach tap water or soap. And please provide students with N95 masks or simply double three-ply mask. And if you have question whether double masking can provide more protection against virus, I would like to tell you that yes, it can provide more protection, because I already just 2 days ago I wrote an article about this that can provide more protection. So don't hesitate to use double mask if you cannot reach N95 masks. Or use some personal protection equipment, as you can see in the picture, this guy with surgical gowns, with dental, masks and head covers as possible, and dental PPEs. Maybe you're familiar with the word personal protection equipment. I want to give you a general description of this term. Personal protective equipments are simply garments, clothing, helmets, goggles that is used for people to protect their body physically or against infection. So this is not used only for healthcare providers or in health system, but simply for other occupations as well. For example, like when engineers are going to some uh, buildings under construction, they protect themselves with personal protective equipment, specific clothing like helmets and other stuffs to protect their bodies physically. But by that, I mean, in dental practice, when we call PPEs, for sure, we mean personal protective equipment against infection. And yeah, and in the following video clip, I want to show you our way of using personal protective equipment in TUMS. Please watch this video. if you have any idea to tell about your school, you can just simply raise your hands and talk about your own school if you want to. I mean, how you use PPEs in your school.
Or if there is additional PPE in your school, additional equipment, or what you simply do extra than other than it is shown here.
No one?
Noor, yes, Noor, you can unmute your microphone or use your video. We are all ears.
Go on.
Hi.
Hi, how are you doing?
Hi, we are fine, thank you.
Really nice for your talking. I'm now focused that you are teacher, not students.
Well, actually, we are students.
Yeah.
Yes, look like from your knowledge. I mean, your knowledge look like.
Oh, thank you so much. It's
Thank
really
you.
nice of you.
Thanks a lot. And I want to talk a bit about also my university, my school, and dentistry departments. We have here four parts of departments, and each part has different equipment and materials. For example, in our maxillofacial surgery and أغشة جراحية, they have like some masks that with the 95 masks, and they put in the masks some powders, and these powders will protect the air drop when enter to the mask during the surgery, because in maxillofacial surgery they take a lot of time, and with talking they can't breathe well. So this is with the filtered the eye drop of the masks. And for example, in other departments, it will be the same. For example, endo, in Terra, in child storm, all of it will be the same equipment with the protect of the face and protect of the eyes. And inshallah, we'll finish this coronavirus sooner because the vaccine is started yet in a lot of countries. So after 1 month, 2 months, we will get about all of these problems, and we'll go and show our beautiful face to the people, and they will see us why we are hide behind the masks. Thank you so much. I will complete.
Sorry.
We get disconnected.
The internet connection was lost.
Now you hear me?
Sorry.
Just 1 second.
Take it.
Okay.
Can we host?
I mean that we wish the coronavirus will finish and everybody will have his own body, his own face, go without any mask, without need anything to hide his face, and
Yeah.
everything will go as before. Like we will go.
Hopefully, inshallah, as you said, inshallah. And I get really curious about that specific powder that you told us. What is that? I mean, do you know what material is that? Because I haven't heard about it.
Do you know in maxillofacial surgery there is some surgeries, for example, trauma in the mandible or maxilla. This is take a lot of time. So the surgeon, when he go and do his surgery, he need to breathe a lot inside the mask without changing it. They put some powders inside the filters of the mask to filtrate the air drop and make it make breathe clearly. One time I will take photo to this and I will send to the group.
Yeah,
All right.
that would be nice.
That would be really nice. Yeah. Thank you so much for your
idea. And what was your faculty's name again?
My faculty is stomatology, and I'm third course now, and I will be implant like teeth implants in the future.
And from which country?
I'm from Baghdad, Iraq, but I'm studying in Baku.
Okay, really nice.
Thank you,
Noor, for your nice.
Thanks to your university to host us. Thanks to your university, and this is the first time that I focus in Iran and in Tehran University. They have like this is a knowledge doctors and professors, and I saw it. The professors from Tehran University, let's say, is better than the people that talk from the Finland yesterday and from other countries, because they want to talk only about the specific materials. They don't want to talk like about their selves, the city, the pictures that took in the past. They focus on the material, and this is real important. And this is one step for you. And maybe in the future, I will come and visit you, and I will see you face to face, and we will do some research together.
Thank you. That
Thank
would
you
be
so-
really nice. We really
yeah.
look forward to it. Thank you. Does
Hopefully
anyone?
we can invite you to our school. And
I will
thank you
be so
for
happy.
this
I will be so
presentation.
happy.
Thank you so much, Noor.
Thank you.
You can go on. Or... Begin, give it.
Does anyone else want to share their idea about their school or what they do in their own faculty with us? Or should we proceed with our lecture? Okay, you could raise your hands and okay, I think
we need to move on, right?
Yeah.
Okay. All right. So this is again one of our colleagues' picture about PPEs. As you can see, he is properly applied PPEs, and he is operating his patient. Okay, I want to talk about a really important and interesting subject. Just 1 month after WHO statement about COVID-19 as a pandemic disease, we as dental students felt responsible to increase awareness, not only in our country, but also possibly in Middle Eastern countries and maybe all over the world. So we decided to organize a campaign called Corona Fighters Campaign about 1 year ago, almost 1 year ago. We provide a lot of informative contents, medias, booklets, posters, and a lot of interviews with international guests in Persian, Arabic, English, and Urdu language about COVID-19. And if you are really interested, you can follow our Instagram page, or you can just simply scan this QR code so you can reach our website as well. And these are some examples that I want to share with you. As you can see, these are patients guidelines, and also a booklet about frequently asked questions for dental healthcare providers. And we provide also some simple informative contents about basic terms like what is droplets, what is aerosol, what can it do, or how respiratory droplets works. I don't want to go in detail, and these are also some informative contents for specialists, for dentists actually, about, for example, hand pieces. Please do not use hand pieces or turbines without anti-retraction function, but use newer ones which have anti-retraction technology. And these are some examples of our webinars. As you can see, we had a lot of webinars and interviews. All was about COVID-19 and different aspects and different courses in dentistry. And one I want to mention is a specific, my favorite one was a webinar. It was almost about 8 months ago, I think. It was about dental schools and COVID-19, because there was a lot of debate at that time whether we should open our school or not during this pandemic. So we decided to organize a webinar. We provide both students and professor section in our panel, and we invite a lot of international students. And I want to mention one of them, Sahar Rafi. She's a friend of mine. I think she's now online in a Zoom meeting. So I want to tell her hi and thank you for your nice presentation. And you can also participate in our webinars if you just simply follow our Instagram page, and you can just be aware of our news. And also you can scan our QR code here to reach the recorded, the whole session recorded in our website. And next part.
So, as my friend mentioned, we organized a webinar about whether or not the dental schools should be open during the pandemic. But this, like all the other subjects in the corona crisis, was not without challenges either. There were some problems. I'm sure you're all concerned about these subjects as well. I just want to mention them. First of all, can we close schools forever? Can we go under lockdown forever and do nothing? Or how do we protect the students and the staff and the patients? Do we learn as students? Because simply our source of learning is to operate on patients, and patients would not normally come to the dental clinic during pandemic unless they're faced with an emergency pain, or they need to be treated with emergency dental procedure. And how can we keep our students safe when
Hello, everyone. Do you have my voice?
Sorry. Okay.
Okay. It got better. Please go ahead,
Okay.
medical.
Okay, Professor. Um, Dental industry has not been without challenges either, and it is a debate going on whether or not we should perform non-emergency procedures. How can we reduce the risk of contamination, considering the fact that we basically work with aerosols, which are high risk source for getting contaminated with COVID. And considering that dental procedures are selective and the need is inevitable, how can we proceed in this during this pandemic? Should we just delete these procedures and just do the emergency dental procedures, or should we find a way to go on with our lives, because we cannot predict for how long it is going to be with us? Can dental clinics be locked down forever? Of course not. So we looked a little deeper in the literature to see if there are any published papers about our great concern, which was whether or not to open dental schools during the pandemic. This research article, as you can all see, talks about the impact of COVID-19 pandemic on dental practice in Iran. And this was a questionnaire-based report. It was done in Shiraz University of Medical Sciences, if I'm not mistaken. I want to share with you the methods of this paper. Maybe you can get ideas from this. This was mainly a questionnaire-based report, and they asked dentists to comment about their personal life, financial status, quality of dental services for patients, and they gathered this information. The results were so. They had total 250 participants, 70% of which preferred not to perform non-emergency procedures during COVID-19 pandemic. And the majority of them, the 87% of them, had problems providing PPE for their dental practice. And 97% of them have stated that they experienced decrease in their financial income. But at the end of this report, they were asked to suggest some strategies to decrease the risk of viral contamination. The 25% of them suggested that we reduce treatment sessions, which is, in my opinion, not possible for all the majors in dentistry. We all know that some procedures need follow-up, and basically this cannot be done for all the procedures. 31% of them stated that we should use PPE in order not to get contaminated. And 44% of them suggested strict triage of patients, and they thought that it would help prevent the exposure to the virus.
Okay, before going to our really interesting section, I want to answer some of your questions in our chat. First of all, Professor Shamshiri, right?
Yeah, Professor Shamshiri.
Professor Shamshiri has written that transmission through oral routes is not confirmed, so oral fecal transmission is not an option. So by that, I mean, we mean that they could separate virus in the feces. So there was written that there might be an option. So it has not been confirmed. I do agree with you. Can we go to the slide?
Sure. Sure.
Yeah.
I just opened the slide.
We just wrote that it's an optional, an optional transmission. So it has been detected in the feces. So they suggest that the possibility of this kind of transmission is not confirmed. You're right. And thank you for your informative message. And the next question was the present. Okay, hello. Do you get specific numbers of patients per day during Corona, or any patient can come anytime? Or urgent cases? I'm pointing at crowded waiting rooms. Okay, now we are not locked down. We have some restrictions, but we are not under the lockdown now in quarantine. But the day when we were in quarantine, only dental emergency procedures were allowed. We also provided a list of centers for dental emergency healthcare in our campaign. We released that for people who want to get these emergency treatments if they want to. But now we are not having any restrictions. I mean, we have restrictions, but we are not in lockdown. So yeah.
But one restriction that we have is that we are allowed to admit only 25 patients per day to our diagnosis department, to our oral medicine department, which triages the patients and diagnoses them, and then further refers them to different floors of the school, different departments. And the limitation for the patient's number is 25 now these days. 25 patients per day can be admitted to the diagnosis department.
And one thing more, they need to pass some order of patients triage. By that, I mean, they need to have temperature assessment, pulse oximetry assessment, and also self-assessment forms. At the end, the center for that, they give our patients a paper that confirms that these patients has been going through triage. And only by that paper, they can be entered to our clinics and do their jobs. So by that, I mean, we are not now having, if we are in quarantine or lockdown, the schools are closed, only emergency centers, but now this is the case. Thank you so much for questions. We are looking forward to see your more questions.
And if you have further questions, please write in the chat. We will answer at the end of the session, and we would be happy to be discussing these issues with you.
Okay, our next section, we want to invite our specific guest, Professor Puyan Amini Shakib. He's Associate Professor at Oral Maxillofacial Pathology Department. He's also an Adjunct Associate Professor at Cancer Institute and also Vice Dean of International Affairs. Thank you, Professor, for accepting our invitation. It's our pleasure to have you in our student panel section. Stage is yours.
Hello, everyone. Again, thank you, Melika and Aylar, for your nice and informative presentation. First of all, I would like to thank all audience for attending this session because I think it has been held very well by our students, and I would like to invite our students in this panel to share their experiences in their school with us. It is very important in this pandemic, in this tragic pandemic, I think, to share our experiences from all over the world to achieve a solution for all problems during the pandemic. You know, I am not well experienced in infection control problems, but my talented, enthusiastic students, Aylar and Melika, invited me because I was a member of the action committee during the beginning, from the beginning, and also during the pandemic. Therefore, I would like to share our experience as management board of School of Dentistry, Tehran University of Medical Sciences, with you from the beginning of the pandemic so far. Let me explain for you some details, and I will concise my presentation into 5 to 10 minutes. You know, it was a very tragic and a very new experience for all of us around the world that we coped with a very unpredictable situation last year in February, I think, 2020. And in Tehran University of Medical Sciences, management board is in charge of managing all issues in dental school. Therefore, management board, which includes dean and also vice dean in administrative affairs, educational affairs, and also international and student affairs, assign a special committee to solve the problems directly associated with COVID-19 pandemic. And at the first step, the committee, which was entitled as Infection Control Committee, invited heads of the clinical departments, including oral maxillofacial surgery department, endodontic department, radiology, pedodontics department, and periodontic department to have a regular meeting weekly to solve the new problems we faced with them day by day. And after that, as my students will explain, that we went to a lockdown for a short time, but we accepted patients with problems with their teeth, with let me explain, urgent problems directly related to toothache, and also the patient which wants to have endodontic problems, which would like to have extraction, urgent extractions. And after that, when we wanted to reopen the school, the most important problem was about preparing the students emotionally. After a long time of lockdown, they were not well prepared for reopening. All the students were stressful. They didn't know how they can face with the new situation. They were worried about their health, and also they were worried about infection to their family. And it was a very important problem for all of us to learn how to cope with such tragic situations and emotionally control ourselves. In this part, we asked our professors to be in touch directly with the students, to talk with them, to convince them about that the school is well prepared for the for the new situations. And also I think our students and also all committees in our schools, studental committees will support us as the management board of the school. They helped us to make a network in a student atmosphere, to talk to each other, to to transfer the problems of the students to the management board, and also the problems of the management board to the students. It is very important to have a direct connection, to establish a direct connection between the person who are in charge of managing the school and also the students who are facing the problem directly, who treat the patients at the offices, at the clinics. We tried to talk to them directly. And also the last part of my talk will about the virtualization. It is a very important part of all of our lives. We should move from a from a traditional, conventional learning and teaching method to a new method of learning, which is commonly called virtualization or online learning. It might not be accepted well by the senior professors and also staffs in schools, but we are in charge to convince them. We are in charge to talk, negotiate with them, to convince them about the the advantages of such learning. Online learning has its special problems, but it is also a great opportunity provided by COVID-19, that we can come together, such as this meeting, easily, and share our experiences with us. Therefore, I would like, at the end of this part, I would like to invite all of you students to build a bridge between your school and your university and other universities around the world. It will help us to improve and to share our experiences, to apply other experiences in our situations. And I think this is the opportunity provided by COVID-19, and we can use such online meetings and also learning and teaching method to improve ourselves. Okay, Melika and Aylar, I am
Thank you
ready
so much
for
for a
the
nice
rest of it.
presentation. It was really nice.
Thank you, Dr. Shakib, for accepting our invitation. I am well aware that your schedule is so busy, especially that you're one of the main organizers for this virtual winter school. I would like to express my appreciation here in front of all the participants. And I would like to thank you for your great effort. If it wasn't for you, we couldn't organize this whole thing. And I'm really grateful that we got the chance to work with you. And I would like to thank you for your great presentation in this panel. I would like to agree with you that this corona pandemic has been a very, very, very unfortunate to face, but there are opportunities that have been created for us. One of the examples is here that we are 175 people sitting in the morning here, talking together and getting to know each other and make further contacts and friendships and learn from each other. And that was one of the most positive things that happened during this pandemic. Thank you again, Dr. Shakib. I hope you stay healthy and you enjoy your day.
You're welcome, but I think the main organizer of this meeting are you and other students in our school, and hope to meet you soon in other panels. Have a nice day.
Thank you so much. Thank you as well. Okay, so to conclude this panel, to make a conclusion, to draw a conclusion, we should say that we as dentists are facing the highest risk of contracting COVID-19, and we are all well aware of that. But we cannot stop our lives from going on, and we should proceed anyway. We are aware that we are facing this risk, but as I mentioned earlier, we cannot close the clinics forever and only execute emergency dental procedures. We should find a way, we should come up with a way to go on with our lives and do them so that they have the minimum risks, both for us, patients, and our families. We should execute the standard protocols. We should lower our work hours. We should limit dental procedures, but not all of the time. As I said, the need for dental procedures, the aesthetic dental procedures, the non-emergency dental procedures, which are also important, is inevitable. So we should limit them, but not omit them. And we should provide proper PPE for practitioners. We showed you the video of how it was done in our faculty, and we heard your experiences as well. And we should do that.
Okay, once again, I want to thank you all for motivation and participating in our panel about COVID-19 and dentistry. It's my pleasure that I was your moderator during this panel. And I want to share one thing with you. When we were preparing our winter school, we were organizing different parts. To be honest, we didn't expect to have a lot of participants in the morning because we are aware that many people are participating from Middle Eastern countries like Turkey, Iraq, or some European countries, and they are at least 1 hour and a half, or I can say 2 hours and a half behind Tehran local time. So that means that they're attending our school at like 5 or 6 a.m. And when we entered the room in opening ceremony, we faced that we have 180 participants, and that was, I mean, wow, that was really amazing. And I'm really proud to be a part of this committee and this group. I have really pleasure to get to know you and make more international friends. Thank you so much. Stay healthy and safe.
I would like to express my appreciation as well. And what was really amazing for me until now in 2.5 days of the event was the friendships I made and what I learned from others too. We had an ice-breaking session before the winter school started. And that was a really, really, really nice opportunity to get to know friends from without borders, without geographical borders. And I think that is one of the main goals of such programs, to get to know others and to learn from them, aside from all of the scientific panels that are happening here. I hope to see you in other lectures too. And I hope that if you have any ideas or any questions, you ask us, and I hope that we could have further collaborations in the future We are Students International Committee. So we're open to international collaborations, and we will be very happy. At the end, I have put some of our social media addresses. You could follow us on Instagram and Telegram. You could email us anytime, and you could visit our LinkedIn page as well. Stay healthy and stay safe. Enjoy the rest of the program. If there are any questions, we will be glad to ask. And we will be glad to answer, sorry. Yeah, thank you all. Okay, I wait a little bit more for the questions. If there are none, I give the stage to our moderators to play a short clip for you in the break. Okay, it seems that no one else has questions, but if you had questions, you could reach us per email and in the WhatsApp group or other social media. Thank you so much. I hope you have a great day. Bye-bye.